boost your heart smarts by separating fact from fiction and setting the record straight on some common myths is Dr. Joyce Johnson.
Hello.
Hi. So we're going to go through a few myths.
Yes.
You sort of need to be on top of your heart health because it is a major killer if you're not aware.
Yes.
And so I'm going to start with myth number 1. So here's myth number 1. I feel fine, so I don't have to worry. What do you think of this myth?
Yeah, absolutely a myth.
It's a myth.
So that's why we call heart disease the silent killer. Often you don't have any signs or symptoms until damage is already done.
Mm-hmm.
So it's really important that you're monitoring your heart health, and one of the best ways to do it is to make sure you're getting your blood pressure tested at least once per year.
Okay, once a year. So let's do a test.
Let's give it a try.
Cross your fingers for me, people. How stressed am I today?
Okay.
So,
All
I
right,
mean,
we'll untangle us.
knowing about a history
Try
in
to
your
rest this.
family of hypertension, which I definitely have in my family, I mean, these are all things you need to be aware of, right?
Mm-hmm. Absolutely. So you're going to
it's
feel a little bit
squeezing now?
of pressure. Mm-hmm. Well, it'll be a whole lot of pressure, but
Yeah. I'm one of those weird people who like the feeling of this. I also like Spanx, so that explains a lot. I don't mind. I don't mind. Is it going to get any tighter?
no. No,
Okay.
it's decreasing now. And then we'll get the reading. Okay, so this particular reading,
How bad is it, Doc?
well, I'm going to write down your numbers here.
Okay.
So this is
132 over 92?
over 92.
What does that mean?
Okay, so let me take this off you, make you a little bit more comfortable.
Yeah.
So what this is telling me is that the normal range here is 120 over 80.
Yeah.
And what this normal range means is the 120 represents what we call our systolic blood pressure, right? So this represents the amount of pressure that the blood is putting on their arterial walls when your heart is squeezing, right? So that should be higher.
Okay.
The bottom number represents our diastolic, so that is sort of the in-between beats when your heart is relaxing. That's what that number represents.
Okay.
So your numbers here, 132 over 92, this would tell me that the blood pressure is elevated, which for various reasons, you know, maybe you weren't relaxed and you kind of aren't relaxing as you're doing a show.
Maybe I'm at work on TV.
Yeah, I know, you're on TV, right? So, and it's always nice when you're doing your blood pressure, make sure that you're sitting and you're trying to relax. You're trying not to like have any sort of anxiety or increase the heart rate.
Right.
I would probably do this again, give it a few minutes and do it again.
Yeah.
Test it again probably a week or two later
Okay.
as well. But this does tell me that you potentially could be at risk for hypertension or high blood pressure.
And is that high? 132 over 92?
It's elevated.
It's
Yes,
high.
It's elevated.
So at what point is it, at what point in the number reading do you start getting concerned? Is it 125 over 95? Like, what's the range?
Yeah, I mean, anything over the normal range means
Is
that
high.
you potentially are at risk for developing hypertension.
Okay.
So we would factor in risk factors. We could factor in the situation that you had your blood pressure tested as well.
Yeah.
Yeah. TV.
No, that's
do
fair.
It.
That's fair. I think
But-
it's good for people to know what their numbers mean because I've never known.
But it's also important that I would get this retested, say, in a week's time.
Yeah.
And like maybe in a more relaxed environment.
Yeah.
And then see where you're at as well.
Yeah,
So
I'll do it
that's
again at a
really-
spa.
Absolutely. Very important.
Check out myth number 2 now. If you have heart disease, you should eat as little fat as possible. Myth
Okay.
number 2, if you have heart disease, you should eat as little fat as possible. Is this a myth?
This is absolutely a myth as well. So fats are important. So the good, healthy fats are important. You want to avoid trans fats, the things that we get out of fried foods, packaged processed foods.
Yep.
You want to incorporate like monounsaturated fats, and you'll get that from olive oil, avocados, some nuts and seeds. These we know help to lower bad cholesterol levels.
Okay.
Also polyunsaturated fats. So that's your omega-3s, and you can get that from, you know, salmon, omega-3 rich eggs. I have some chia seeds as an example, or in a supplement form as well if you're not eating these on a regular basis, because we know that helps to thin the blood and decrease your risk for strokes and heart attacks as well.
Okay, good. So get those good fats
Good
in
fats,
there.
absolutely. Don't avoid them.
Good. Okay, here's another one. Heart disease is really a man's problem. That's our next myth. Heart disease is really a man's problem. I'm imagining that this is definitely a myth.
It is a myth, unfortunately. So the Heart and Stroke Foundation does say that heart disease is the #1 cause of premature death in women.
Yes.
And it does kill women 5 times more than breast cancer. And one of the problems that we see in the healthcare field is that women present differently with a heart attack.
Okay.
So men will experience that crushing pain in their chest, and it's so classic of a heart attack, where women may present to an emergency room or just at home to their own family, shortness of breath, they might be nauseated, they might vomit, they might have dizziness, extreme fatigue, jaw pain, back pain. So these are classic signs and symptoms. So it's important to be aware of this.
Yes. Okay.
And then what happens for women as we reach menopause, our ovaries stop producing estrogen, and that means it stops protecting our hearts. So that means we start to put more body fat around our midsection, which puts us at risk for diabetes because controlling blood sugar is important. It increases our cholesterol levels, our bad cholesterol, and it can increase our blood pressure. So I brought along some foods, plant-based, really excellent at helping to decrease these 3 risk factors.
Okay.
If you do have high cholesterol, statin drugs can decrease CoQ10 that your body produces. So it's important to just be aware of all of the heart-healthy foods that are out there. And something as simple as, celery stalks. Celery stalks, eating about 4 of those a day can be helpful at helping to lower blood pressure.
Really? Huh. Figures it had to be celery, the one vegetable that's like, really, celery?
I know, but it's hardly any calories. It's lots of fiber
no calories, and you're actually going to feel like your teeth are doing something, gnawing through those suckers, right?
Make a bowl of it.
Totally. Okay, let's look at this next one. If you have heart disease, you need to take it easy, okay? Is this a heart health myth? If you have heart disease, you need to take it easy.
Yes, it is a myth. It's important that you're incorporating some exercise.
Yeah.
So even if you haven't had a heart attack or any cardiovascular incident, it's important that you're incorporating exercise into your lifestyle at any age because that's going to be a healthy habit for later.
Yeah.
If you've had a cardiovascular incident, make sure that you've spoken with your doctor. Maybe you're going to a cardiovascular rehabilitation center and they can put you on the right program. But absolutely, physical activity is going to strengthen that heart, and that's a very important muscle.
You need to move.
Yes, you
no
do.
matter what. Such good information. Thank you for that.